Yes, today, guys, I'm coming from right from the reception of Benham Medical Center. Benham Medical Center, and as the title is saying, we are going to talk about hospital-acquired infection. Hospital-acquired infection, and sometimes hospital-acquired infections. You cannot know how you get them. You may not know how you get hospital acquired infections, especially when you walk in the hospital and you feel that the hospital is very clean, and you think touching of surfaces is okay to you. You get it? Hospital acquired infections are bad, and they can damage you so much. Have you ever wondered why children are not allowed to go to some places? You go to visit someone in a hospital, and then you are told that no, the children will be left somewhere, and then new adults will come in. Have you ever wondered why? Sometimes it's important to note and to know why, because I've been in hospitals sometimes, and you find that some people are fighting the security guard because they are the ones which take care of the issues there of controlling who can enter the wards, who cannot enter the wards, and it becomes a bad hassle. So hospital acquired pneumonias, infections are strains that you can acquire anywhere, strains that you can acquire within any place that you are in the hospital. You can be a sick patient going to be admitted with a disease that is not hospital acquired, but when you get to the hospital, you kind like get infected with a disease that you did not go to the hospital with. I've said so many times, people go to hospital not so serious, and sometimes they get out so serious because now you went to the hospital and the handling that you were getting there was not okay. So let's talk about hospital acquired pneumonias, infections. What can you get in a hospital? There are so many strains that you can get in a hospital, like you can get like pneumonias because of it can be viral, it can be streptobacterial. You see, it depends because let's say when you talk about respiratory cases, most of the time they are spread by vector. Vector spread, it means that you are coughing and you are spreading the pathogens to the other person or the environment that you are in. Like let's say this reception is not a very big reception, but you can get a hospital acquired pneumonia through going to places. Now you see, this is a compacted place, and then you come with your kid, you want someone to go and be admitted, and then this person is coughing so much, and there are some other clients that want to be helped at this reception. These people will be coughing, and you will not know if the person has a virus or a bacteria. So at the reception, it's very important to note some things when you go to a hospital. You go to a hospital, and then you have kids that are touching surfaces. Not all the surfaces in the hospital are cleaned at every time. We are talking about hospital acquired infections. They are not cleaned every time. So, like, let's give an example of this one. You have your kid, someone came earlier that was sneezing, and he left while he was leaning, like right now, I'm leaning here. The receptionist has gone, it is 10 at night. So you're talking to the receptionist here while you are leaving here, like the way I've touched, while you are leaving here and you are coughing. And that's why we put some glasses to shield, because the receptionist who is here can be affected. You see, so the person who is coming is touching these surfaces, and he is not aware that there is another patient who was here touching this surface, and you start holding your nose. That is one step of infection. One step of infection. The next thing is a person who is seated down, coughing around, can infect that other patient who has come with another disease. You get it? So there are so many forms of hospital-acquired pneumonias, infections in a hospital, that we follow up and we see, and then we want to start questioning ourselves when the person is admitted in hospital. Where did we go wrong? So safety measures: when you go to a hospital, you have a kit, stop touching surfaces. Stop touching surfaces. Always check on marks that are down the floor and the walls, because people are brought in hospitals with different problems. You see, you can feel this place is so clean, but there are some marks of that is down, and even blood stains at times. So hospital-acquired pneumonia infections can be controlled by the health workers, by you, the patient, and also by the management of the facility. Cleanliness is very important. Putting on masks when you are in the hospital is very important. You get it? It's very important to be putting on masks when you are in hospital, because the coughs and the air around. You see, when people are sick and they are in the hospital, even the people that have wounds, those wounds are producing some gases that are going around. And if they are producing some gases and some pathogens, you may get the pathogens in you. So visiting a hospital is a good thing, but taking care of yourself is even a better thing. It is classical that if you are a health worker and you are in a hospital, today I'm bringing the live from the hospital reception, where this is them. It is called Benham Medical Center. Benham Medical Center. That is the hospital that I'm in. Yes, Margaret, welcome to the church. Today I'm talking about hospital-acquired infections. People come to reception and they think this reception is so clean. Not forgetting, sometimes emergencies happen at reception areas. You see, emergencies happen at reception areas, and someone can leave a syringe while taking, when you are doing an emergency in a hospital, someone can accidentally leave a prick, like the lancets that we use to prick so that we can do RBS. RBS is a random blood sugar. Someone can accidentally leave it, because most of the time when these patients are brought in hospitals, when they are sick and they cannot, maybe sugar levels are down, it's an emergency, and everyone is trying so hard to find a way of helping this person. So they come, and then you remove a lancet, you prick that patient, and hurriedly you put the lancet on the finger, getting to know the sugar levels and to know how the person is. So when you leave it and you take the person to the emergency area where you want to help this person from, you have left the lancet are small. Someone can come and step on it without. So when you're coming to a hospital, it is very important to check yourself first. Check where you are sitting. This is the reception of the hospital. Is there anyone who is coughing around without masks? Is there anyone who is coughing around without mask? Is there anyone who is seated and is bleeding around there? Are there tiny things like lancets that are left around the reception area like this one? Are there people lying around? Because you can come with a simple cough and go with something at home like hepatitis. That is a hospital acquired infection. You came to the hospital wanting to be helped. You pricked yourself with something that had blood, and that blood had, like, say, hepatitis C or B, and then you go home doing what? With an infection. It is very important you note those things. Okay, we have talked about the reception and how you can take care of yourself around the reception. First of all, when people are coughing, always have a mask. You saw Juni Gapol, welcome to the chat. If you have not subscribed, please subscribe. Jamie, so we have talked about issues that you can get around the reception like this one of Ben-Hur Medical Center. You can get infections by pricks, by accidentally pricking yourself with another prick that someone had used, that as hurriedly they were taking that person, you pricked yourself when coming in. Second, maybe you have a wound, you can step on blood or secretions. You know, someone can vomit and then you step on those secretions and you have a wound. That is a site of infection. You get it? Now, the other thing you can get around is vector. You don't have a mask, you are at a reception like this, you think it is very clean, and people are coughing always when they are, and that's why sometimes when we are at the reception, it is important to give space to people. You don't crowd at the reception. When you feel this place is crowded, you go and sit some other places. It's so important. So not those things that we have said. Then you come, and that's why you see, let me do this. Look at here. This is a glass. This glass is here not because we want it to look beautiful. No, that glass is there because you see how it looks. That glass is there because of vector infection to the person who is seated inside here. This person who is seated inside here is at risk of so many things. Imagine the time of COVID. A person comes with COVID and is so coughing, and the receptionist is here. This one is protection from many things. Blood, touching, because the person can end up putting the hand there so that you get it. So this one protects the person that is there. It is very important, and every day in the morning they sanitize these places with hypochlorous acid. Hypochlorous is jig, the normal jig that we use, so that it can kill pathogens. But you see, as the day goes on and people come in, you may not know, because some people just touch here and they go. Yeah? And you think it is clean. So we are talking about hospital acquired infection. Let's go and check. We have talked about the reception. Now we go to these rooms. When you enter rooms like these ones, you'll always get a bucket like this one. Check at that. You will always get a bucket like that. That bucket is an important type of bucket for people not to get infections. You see, it has somewhere to step, and most of the time, I think this one has been, because it's at night, they have taken the dirt. They are coated with some polythene bags. Never go to a hospital and throw something inside there and try to get it out again. Those papers, those things that are there, they are dirt, they are harmful, and they can bring a lot of problems. So these buckets are important. There is a way of segregation where we have red, we have red, we have yellow, and we have black. So black is for papers, you will see them. And then there are rooms. When you get to rooms, you get to a room like this one. This is a room whereby it's called a triage room. If a person comes in here, seated there and there, someone can vomit, or you want to weigh your child's weight. Like people come to hospital with their children, and they want to weigh their children. There are some things that you need to check out. Like this one is a weighing machine of a child. Let me remove the dust. This one that we are seeing here, let me remove this. This one is a weighing machine of a baby. The one that you are seeing, this one. Before you put your child on that weighing machine, look at it as the parent, because you can go to some hospitals, the machine is so dirty, and some children have vomited, or they have removed their sputum. Maybe they were bleeding. You know, some children bleed. Maybe they have wounds, or they have infections. Look at that weighing machine. Make sure it is clean. Before your child goes to be weighed, you make sure that the machine has been sanitized. Then the person will ask you if you have your own. If you have your own, play something like a cloth, a piece of cloth to put there that is clean. But there are the other things that you should look at mostly. Where you are sitting, is it a clean place? A hospital, people come there with very many complications. And when you visit a hospital, you see, we have just come from the reception, and there are some many things that you should look. Because let me go back to the reception and see. You see, this is the reception here, and you can look where the people are sitting. Check about the sitting position. Do you have enough space? Is the place that you are in, is it having enough air circulation? How many people are at that space? Are the surfaces clean? Are they sanitized? Do you have a mask when you are getting to that hospital? Let's go in to we have talked about the dustbins, the bins that are there. Never touch this bin in a hospital. Never touch this bin. Always step on it. And then we have come to this place, and we have talked about a specific thing, that is the weighing machine, the equipment used to take. There is this machine that is called as phenometer. This machine is called as phenometer. This one. So this is a cuff, and it is placed on your arm. This cuff should be clean, because it can be a portal of spread of some diseases. You get it? It can be a portal of spread of diseases, because if a person used this cuff, this is, it is, look at that machine. I want you to look at it. This one, it's used to take blood pressure. It is used to take blood pressure, and we use this cuff to put around your arm. So if it was dirty or it had an infection, you can get a skin disease. When you're taking some measurements like blood sugars, make sure the lancets that you are using, I don't know if a lancet is here. Let me check if there is a lancet here. A lancet is a pricker. The pricker that you use when you are taking, let me check if there is lancet here. When you are taking some measurements like sugars, and you are doing some tests like HIV, those are called lancets. Unfortunately, they are the other side. So those are things you should look at when you are entering a room. There are some things, you see, like this one is a drip stand. and you see it is in the office, is in the office of someone. This is not my office. This is the nurse, the main nurse office. It's called the matron. But you see, it has a drip stand inside, which means when the matron was helping someone, this drip stand was used. And you never know what kind of infection that person had. You check it. So we check on those simple issues when you're getting, so that we cannot get hospital infections. And then you come out, there is some places that people put dirt before they are taken somewhere, although it's dirty like right now. You see that the papers are put here ready for transportation tomorrow morning. It's at night right now, and you cannot visualize well. So these are things that you should check on the ways. If they are dirty, you look, and when you're going to the loose, you also check for those places. Now this is a place that is very important. This place is called an acute room. An acute room is not a place to play around with. You see, an acute room has the examination bed here, and it has got also the bucket, and it has got a very infectious thing in life. Never go to a hospital and you see that sharp box and try to touch it. That is a portal of many diseases and even cancers. And that's why it is put on the near the examination bed. If you are putting a line on someone, or a relative of someone is here where I am working on someone, this relative should not be at this acute place. He should be standing there or behind as we work on the person, to avoid what? Pricks, to avoid things that can harm this person. Like you see this one here, we have several emergency kits, we have syringes, we have everything, we have giving sets, we have, you see, even I can see there was a person here. We are learning new things. Welcome Margaret in Norway. Today we are doing hospital acquired infections right from medical center. Right from Benham Medical Center. Now, an emergency place. I can see someone was here and used. So these ones will be cleaned in the morning when they will be taken to be washed. Now, you see, I've said when you are resuscitating is doing things faster and faster so that someone cannot die. A relative should not be here. And if they have requested they have to be here, they have to stand away from that resuscitation place, because here we have nebulizers for nebulization. Very important. I will show you. I know some I know some of you have never seen it. This is something called a nebulizer. I want you to see it. A nebulizer, things for resuscitation. So this nebulizer uses a mask. Be very careful when you're getting there not to use a mask that was used, because maybe this is a mask. This is a mask, and you can get an infection from someone else who had used this mask. So things like nebulizers are put in places like this one for emergency control. Today we are talking about hospital acquired infection. It's a very important topic, and I want people to understand. So we have said a mask should be clean and come from a place from a wrapped polythene bag. Don't use a mask when maybe someone has come with a blocked nose or asthma, and we are trying to nebulize, and that person is using someone else's mask. No, we don't do that here. It is very important. You can get infection. Yes, Mercy Grace, thanks for coming today. I'm taking people around to know what to do when they are in hospital. Now, you see, like here, here is the bucket. if this person have to receive an IV drip, it should be, the drip stand will be here. Get it? So you just step and throw your what you have there. Children are not allowed at this place. The acute area is where resuscitation is done. Unless the kid is sick, he should not be here. Now, let's go. Now, here, the acute room here, you should have a mask. I don't have a mask because there is no anyone who is being resuscitated right now. We go this side. You see these walls. You check on the walls. Check on the walls if there is anything that is here that is like blood or secretions or water. We have come from out here, and it is important you check several things on the walls. And we have places like where I missed it. I missed this place. Now this is a very important place, and this place is where we put dangerous chemicals. You see, this is hypochlorous citric, and some gases that are here. So this is an area whereby children cannot come in. Children cannot come in because if you check now down here, we have we have something called an incinerator. An incinerator. This is an incinerator. A child can come in here when this is. It can bring other troubles. You get it? A child can come here inside and touch these chemicals, go and be admitted or go home with an injury. So those ones are what we call hospital-acquired problems or infections. You see, look at this. Let me touch one. Used. You get it? The internet is not good. Okay. But in my side, is there anyone else who is feeling the internet is not good? Because in my side, I'm feeling it's okay. In my side, I'm feeling it's okay. If you are having trouble with your internet, please tell me. Please tell me if you are having trouble with the internet. So this area is out of bound, and you notice every area has a sharp box. Look. This is a sharp box. This is a sharp box, and that is an incinerator. We can't see good. Okay, that is a sharp. It's because it's at night. Some areas have no light. You see, so that is a sharp box, and that is an incinerator. And this is a place where we keep chemicals. Now we go this side. This side we still have a sharp box. You see, you still have a sharp box. Look. That's a sharp box. At the crossway to go down, let's go now and learn about a short thing about hospital-acquired infections. It is important because people visit hospitals. You see, every place we have this. We have every place we are going. We are having a bin with the sharp box. You get it? So these are things that you should note. And I've said you check on secretions in the wall that can bring problems. Now that I've taken people around, today I've taken people around the hospital, and I've just gone to parts of the places. Some places I could not go because they are limited, and someone can sue you because of showing their faces or bringing them live. So you've seen that is about the reception, you've seen about the offices, you've seen about the acute room where people are being resuscitated. It is important for those people who go always, you see, those people who visit hospitals every time or concurrently, those are the things you should do. You see, in hospital, it is, you can get an infection. I know some of you've visited hospitals. You as a person, our mothers, I am always proud of our mothers. If you are not getting me clearly, please tell me. If you are not getting me clearly, please tell me so that I can raise my voice. Our mothers, when they are in hospital getting children, they can come there with problems that can be bad to their Mercy. Oh, Mercy, I was going around the hospital and some places dark, so people could not see well. But I hope the reception area you've seen, it is okay. It is at least lit up. So we talk about things you can get in hospital. And my friends, happy Easter holidays wherever you are. Happy Easter holidays, everyone, wherever you are, and enjoy with your family. You see, what are hospital-acquired infections, also called nosocomial infections? There are infections patients get after admission to a hospital, not present at time of admissions. Mostly those patients that are admitted, they get hospital-acquired infections. Why? There are some examples like urinary tract infections, pneumonias we have talked about there, when people don't have masks and you are coughing and you are around that person. Surgical site infections, you can stay in a hospital, you have a wound that you did surgery, and then it get infections because of the things that you are using as beddings. You get it? Blood infections, bloodstream, you have a wound and an infection comes in. And there are some things that are called vector infections. What are vector infections? A vector is a living organism that transmits disease-causing pathogen. A vector infection, you get it? Common like mosquitoes, flies, cockroaches, and rodents. Some hospitals have rodents. Some hospitals have rodents. Cleanliness in the hospital is not okay. Some cockroaches there, they are spreading infections every time. Be careful about them. Flies, they should be controlled. If you go to some hospitals, you go to the surgical wards, I wish I could have time to go there, you will see some wounds that are smelling and lice are coming. They should control this. When you have wounds, always have hydrogen peroxide to kill the pus. Even at home, if you have a wound and it has pus, kill the pus with hydrogen peroxide so that wounds, flies cannot be following you every time. Hospital-acquired vector infections are very bad. If you get mosquitoes, people think mosquitoes transmit only malaria. No, malaria is one of them. There is something called dengue fever. Dengue fever. It carries the pathogen itself. You get it? And then when a mosquito bites you, it brings the dengue fever. Mostly, I think dengue fever is in parts of Zambia. Live, laugh, like Dan. Thanks, live, laugh. Welcome. Dengue fever is there is a mosquito called Aedes aegypti. You get it? That transmits this. It's a viral infection. It's a viral infection and it is very bad. You can get a very high fever. Very high fever. You get it? So when you are in a hospital, don't just think of mosquitoes alone. Don't just think of mosquitoes alone. Think of like dengue fever. You see, fly-borne diseases like typhoid fever and cholera. Flies in hospital. I've seen in surgical wards, in maternity, some wounds that are not taken care of. And that's why at times I say, when we are medical workers, let's be medical workers. Nurses in a hospital, my sister, you want to be a nurse. Take with passion what you need, what you love. Do it with passion. Those wounds, dress them with passion, because you are not just helping that person, you are helping the entire community that is coming inside and out of that hospital. Rodents born like rodents, like rats, herbs and spices. So welcome to the platform. We are talking about hospital-acquired infections. Rodents can pass diseases that are called leptospirosis and plague. I know someone will tell me plague went away so many years ago. They are still there. So don't take chances when you are in hospital. Cockroaches, E. coli and Salmonella typhoid. Typhoid. You can get typhoid from cockroaches that are passing through the surfaces. Risk, you see, there are some things. Let me talk about risk factors in hospitals. Risk factors in hospitals. You can get poor hygiene and sanitation in a hospital, and then there are rodents and flies and everything. You will, and you have gone there with a person like a child, and you are visiting someone, you come out with this. You see, it's very bad. Improper waste disposal. I've just gone around, you have seen some waste bins and some boxes that have that we dispose sharps. Sharps are like needles. Sharps are like razor blades. Those are called sharps. The pins that we use, lancets that we use when we want to do something like HIV. Let me find one lancet. You see, let me find one lancet. See? I don't have them in my office. I will show you what lancets are. So poor hygiene is very important in this. It's significant thing in hospital acquired infections. Improper waste disposal is another thing. Stagnant water, the drainage along the waistlines. Have you ever gone to a hospital and then you find it is so with the water everywhere? The drainage is poor. The drainage, even you cannot even you jump places so that you can go at a particular place. It is important to note that if you get to such a hospital, don't waste time and be there. Move and go away. Things should be always clean. Things should be always clean and put specific place, especially public hospitals. Yes, you see, sometimes in public hospitals, people do work because they are paid. And when you get there, you find that even the people who are there don't have the, you see, that's why nowadays people, I wish the public hospitals could be the place that everyone wish to go. Everyone wish to go. But it is the reverse. Public hospitals are where people don't wish to go because of these things that I'm saying. Sanitation, management, overcrowding. We have been at the reception there. We have talked about crowding. You've seen, you can get infection at the reception. Poor ventilation. You are at a place that is so compacted, even air cannot get there well. So bad. It is not okay. Lack of pest controls in hospitals. Lack of pest control in hospital. And then, now, what can you do to make things better in this? Yes, Mumbwa, hi. How is you, Mumbwa? How can we do to make things better at such places? Proper waste management. Eliminate stagnant waters. Regulate cleaning and disinfection everywhere. Vector control, insecticide sprays, mosquitoes, rodents. You get it? Hospital practices, infection prevent protocols. Infection prevent protocols is very important. Now, let's go again to let's go to the reception so that we see what I mean when I'm meaning of infection control protocols. You see, let's just come with me. something I want you to check. There's something I want you to check which is very important. You see, at this region, there is no dustbin. Here, there is no dustbin because some people can damage it or children can play with it. But if you come with me like this, you will see there is a dustbin there. And there is a sharp box. I want you to look at them. There is a dustbin and there is a sharp box. So if someone is seated there and wants to dispose something, he'll have to come this side and dispose that thing where? Here. You see, if someone is at this place and wants to dispose something, he'll come to this place here. Every place has got dustbins. Even outside here, we have dustbins. Now, let's go and finish hospital-acquired pneumonia. Even at the acute places, we have dustbins there. It is very important how you dispose your dirt in a hospital. It is very important how you dispose things in a hospital. You have seen at every place that are moving, there is a disposal place. Isolation of infected people. If someone comes with dengue fever or let me say cholera, we will not put that person at an acute place. There are some place we will put that person so that that person can be controlled. When you are going there, you have the right kit that you've put on so that you can go and see that patient. So you who is giving the medication, everything cannot be infected. You get it? Now, there are some strains. These ones I'll just go through faster and faster. When someone is having a urinary tract infection, UTI, what can bring it? Maybe it's a man, and this man came with prostate problems, and we did use a catheter, and this person has stayed with the catheter. It will give that person UTI. It will give that person a UTI. Another thing is, let's say, the surgical site. This person is in hospital because he was done a surgery. Occurs after surgery, you get surgical place and the beddings are not clean. So most you get this getting even the dressing itself is not good. So you get this person getting that around the surgical place. He'll get an infection. And he came, it's because we did surgery, then this guy gets an infection and stays in hospital for long. You see, when you get an infection in hospital, you stay in hospital for long. Pneumonias, especially ventilator association pneumonia in ICU patient. I've showed you a mask. Those masks should be clean when they are used. Bloodstream infections are infections often linked to central venous catheterization. People who are undergoing dialysis. Dialysis patients should be checked on, and the central catheter should be cleaned every time. Those ones are things that you can go in hospital while you don't have an infection, and you come out of the hospital with a very bad infection. You get it? Clostridia difficile infection associated with antibiotic use. Clostridia, tetanus. Be careful. And I've seen some people always when they go to hospital, any simple cut to a child, they tell the doctor, please give my child tetanus. There is a protocol of giving tetanus. Don't be forcing doctors and health workers to give your child tetanus. Ask the doctor if the child can get tetanus. He'll ask you some questions, then he'll say, okay, your child can get tetanus. Sometimes I've been accused because some children get wounds and I decide not to give tetanus. I become so harsh when when I hear some children want to be given tetanus. Some parents always take their children and go somewhere else. They are given the tetanus. You see, they'll get problems in future. Okay, there are some strains that give hospital-acquired infections like Streptococcus, Escherichia, Klebsiella. Those are strains of the strains that can give you infections, and multi-drug resistance organisms like TB, TB is a bad thing. Risk factors of a person who can get hospital-acquired infection. 1, prolonged hospital stay. You are okay, and then you don't have a money bill to be discharged. You continue staying in hospital. You will get hospital-acquired infection. CU admissions. You've seen somewhere the masks and the catheterization can give you the infection. Use of invasive devices like catheters, ventilators, and IV lines. Because when you are in hospital, we give you drugs by IV, the veins. So you see, this is something that is not, it is a strange thing for your body. You will get infection. Recent surgeries, and some people go to hospital and they are immunosuppressed. You have cancer and you are exposing yourself. You have HIV and you are exposing yourself. You are immunocompromised. Be careful with masks always. Use of broad-spectrum antibiotics always. Without being told by a doctor you can use this. Please be careful. Antibiotics can be good, they can treat you, but they can give you bad immunosuppression. You understand? So use antibiotics when they are needed and when you have talked to your doctor. Prevention measurements. How can we prevent these things when we are in hospital? How can we prevent these things? We can prevent by checking on several things for ourselves. We can prevent by checking on several things for ourselves, like what? We can hand hygiene, because we have sinks. I've not shown you. We have sinks. When you get to hospital, make sure you are washing your hands. Sterile techniques during procedure for health workers, proper catheter and line, antibiotic stewardship. Always ask before you use an antibiotic. Environmental cleaning and disinfection. Isolation when needed. If a person comes with cholera or typhoid, we isolate. We don't want people to get it. So that was a very short session of hospital-acquired pneumonia. I think at least today some people have seen Benhab Medical Center from the reception. yes, that is Benhab Medical Center. And I really need to say this. If you have an issue about anything, don't hesitate to email or text. You need some advice or for help. So anyone with a question about that short session, anyone who has a question today night, if you have a question, let's see if you have a question. Anyone with a question before I log out? If you feel you have a question, you can ask. Anyone with a question? I think it is okay. We don't have any question today. So I'll end the stream and continue living in a healthy life. It is Easter holiday, so long. Eat well, discipline yourself so that you cannot get abdominal problems. Tomorrow we will see what time we will get to do what, to start our life. That is Marlene Ruth. Thank you, Dr. Benjamin. Welcome. We will see what we will do tomorrow, but we are still on cardiovascular issues. So have a lovely day, a lovely night. It is at night here in Kenya. Have a lovely night, everyone in Kenya. enjoy your holidays, and pray that we have less deaths, and we do what we continue saying that God is for everything. Bye. See you next time tomorrow. Bye bye.